Okay. Right. So, is the patient?
Okay.
Okay, and that is the first task. Do you need time to
Yeah.
prepare, or do you?
Okay. 1 minute, please, doctor.
Okay.
Dr. Shukui, meanwhile,
Yes.
may I ask you about the way for improving listening?
Okay. Yes, we can certainly discuss that. Let's do this job, and in the last 5 minutes of the class, we will talk about that. Okay, how you
Thank
can.
you a lot.
Okay.
Thank you a lot.
All right.
Thank you a lot.
Okay.
Okay. We
Ready?
can start, doctor. Yes, I am ready.
S- So, you're very anxious, and you're having some difficulties after the operation,
Yes.
and
Yes.
swallowing and speaking, and difficulty breathing. Okay, and why?
Yes.
Okay,
I.
right, and precautions. Right.
Yes.
Okay. Um, Hello. Yeah, come in, please. Have a seat.
Hello, doctor.
Hi, Neda. Have a seat. How can I help you today?
Doctor, as you know, I had a thyroid surgery, and after
Right.
that,
Yes.
I have problem with my swelling and problem with speaking. I am here to know how can I manage this problem.
Okay. So, swallowing and speaking problems. Yeah. Is that
Yes,
okay? So, when did you have your operation?
about 2 weeks ago.
2 weeks. Okay. And was there any complication, or is it was okay when you came out of the hospital? Did you have to stay for long, or
No, no, as a routine, I stayed at hospital 1 day, and then they discharged me
right? Okay.
about 13 years ago.
13 days ago. Okay. So, and did you have this difficulty from the first day, or what, is it getting better or worse?
About it started from 2 days after I was
Okay.
discharged,
Right.
and I think it is better than the first time, but
Okay.
I have problem now also.
Right. Okay. So you still have the problem, but
Yes.
it is nearly, so it's 2 weeks you had the operation, and it started to cause you trouble after 2 days, which is about 11 days ago. And then in these 10 days, you think it's getting a little bit better. Okay. So,
Yes.
so the breathing is better and the voice is better. Um,
Yes.
um, so, is that all the time? I mean, the breathing problem, or is it at particular times? Is it in the morning, in the evening, any special time?
I think in the evening is worse.
Okay. Does it get worse when you lie down, actually?
Yes,
Okay.
completely,
Right.
doctor.
And is your swallowing the same? Is it the swallowing getting worse?
Yes, after eating some solid things, it gets worse.
I see. Okay. Okay. So the swallowing and the breathing and the speaking, all of them are causing you trouble when you eat, or is it just swallowing?
Only swallowing,
Only
doctor.
swallowing. Okay. Okay. And so, do you feel very short of breath? I mean, do you feel like you're not able to breathe, or do you feel worried about that?
About 11 or 12 days ago, I feel shortness of breath, but
Okay.
not now.
Okay, so it's better now. Good. So basically, you think that it is getting better, and you don't smoke, and do you go to work, or you don't? You're off sick at the moment.
I am at sick,
You're
doctor.
You're off sick. Okay. So, well, obviously, I understand that these cause you so much problem, speaking, swallowing, breathing, all that. I'm really sorry to hear that, but this is what comes with the operation. You know, this is basically you had an operation in your neck area, and there is a swelling. Obviously, this swelling needs to go down, and it takes time, usually 2 to 3 weeks. And as you mentioned earlier, it is getting better, and day by day, the swelling goes down and things get better. Now about the swallowing problem, obviously, you can try to take smaller uh, pieces of food or softer food. And for speaking, we normally recommend you to give your vocal cords rest and not to talk too much. So I know it's difficult, but it is possible to speak as little as possible. And then for breathing is actually uh, um, it's worse at night because you're more anxious because basically you get worked up with the thought that something might happen to you or things like that. But it's really not that much pressure on your breathing area. But just in case, whenever you think that it's too bad, you can always call for an ambulance or go to the hospital or A&E. But this is not unusual to have this feeling of breathing problem, this much problem basically. It's not acute, it's not sudden. So if it happens suddenly, that's something we are worried about. We think that maybe there's a broken blood vessel or something, or the swelling has got worse very quickly because of infection. Or, but if it's getting better, it means that it is actually recovering, and you're recovering from the problem. So this is not anything unusual. Is that what you were worried about? Is that I mean, is it okay? Am I answering your question, or are you still having any more questions?
Doctor, I want to know how much will it take to get recovered because I must return to my work, and it is necessary for me to speak, for me speaking to client, and I need my voice, and
Right.
I need to
Okay.
be normal.
Well, obviously, we say we normally take 2 to 3 weeks as the usual recovery time. And in case of your problem now, because it's already 2 weeks and you have not fully recovered, it might be another 2 weeks. But what I can suggest is I see you back in a week's time, which is 3 weeks after operation, and we see how you are. If you're okay, you can go back to work. If you think you're still having trouble, then obviously we can give you another week off. How about that? Do you agree?
Not bad, but is it possible for you to give me some pill, some medication that I feel better and I can back to my work sooner?
Well, yes, I mean, the medications you have been taking are really helpful, and they're supposed to make your recovery quicker. But I think that they're the only tablets we can use, and you just need to carry on with those and take them regularly. Is that all right?
Okay, thank you, doctor.
Okay, thank you.
Thank you.
Wait. Time is over. Okay.
Yes.
So, okay, what happened? What was Uh, did I do anything different?
Yes.
Yes.
You
What?
summarize
Okay.
signposting.
Okay. So, basically, in information gathering, uh, what I did was I was listening attentively. I said, "Okay, uh-huh," and then I show. Did I show empathy?
No, I
guys?
didn't.
Yes, you
No,
should.
I.
Yes,
Yes.
you did.
Yeah. I could have said, sorry to hear about that, or sorry to hear about your difficulties. I could have said that earlier in information gathering, but while the patient was telling me, I said it later, basically. I said it after summarizing. But I could
Yes,
actually I could show more empathy here, okay? And
yes,
what else? Did I gather enough information?
yes. I think the time is good. The Yes,
Uh,
I think it's good. But
So basically, that's what I call exploring ideas, concerns, and expectations. Okay, did I do that? I mean, why the patient was at the surgery? Why the patient came to see me?
because of problem with breathing,
Okay, anxious because of breathing, swallowing,
yes,
and voice. Okay, did I uh, did I ask questions about all of these?
yes, completely.
Okay. I ask a lot about breathing because it is so important. Then I ask about swallowing. I could ask more about what sort of food you're eating. Okay, that is
Yes,
something that could help. So that was something which I could ask further. And about the voice and uh, saying that, what do you mean by difficulty talking or with your voice? What is wrong with your voice? And does it hurt when you speak? So I could also explore further the voice. And the fact that you told me later that you need your voice for your work, that is a significant point. Okay. Did I have a structure?
yes,
Was yeah.
checking.
So the structure was good because I signposted and then I also summarized. Okay. That helped with the structure. How about information giving?
That's it's very good.
But I wasn't happy with that. I had a problem with that. What was it?
Giving. Uh,
Sorry.
mm, about the why this happened for you.
Mm-hmm.
It's the complication of thyroid
Okay.
surgery.
Okay. But I didn't do much chunking and checking. Okay. I actually lectured all through.
Yes,
Uh,
yeah, true.
okay. And that is not good. That's not something we want. Um, Basically, and then I explained a lot, but I could actually chunk it and say, well, you had an operation in the thyroid gland, and you know where it is. And she says, yes, I know where it is. Okay, and how much do you know about the operation, and how much would you like to know? And then I say, well, obviously, where you have operation, you will have swelling. Is that right? Is that okay? Do you understand me? Um, so just like that, just chunking, giving a piece of information saying that because of operation you will have swelling. Is that okay? Is that clear? And you say yes. Obviously, when you have operation, it is sore, and you will have swelling. And then so that swelling takes time to go down, and usually 2 to 3 weeks. So that's chunking and checking. I could do better. Anything else do you think I could do differently?
Yes. You
Examination.
you sorry. You have some multiple question in one
Good.
time.
Okay. Okay. Examination missing. And multiple questioning. What is that?
Mm, For example, you ask two or three question in one part. Uh,
Yes, absolutely. Did you notice, Neda, that I was,
Mm-hmm.
yes. And did that confuse you?
No, because maybe I am a doctor and
Okay.
not a patient.
Okay. Yeah, I mean, if you because that I said or yes. So I was asking you questions, 2 or 3 questions at the same time, and the patient needs to think, okay, which one should I answer? So we don't want that.
Yeah.
Okay, right. Okay, so that's how I want you to look at the consultations. Now, coming back here, guys, to the understanding and incorporating patient's perspective. So, after the relationship building and after we start gathering information, now we've talked a lot about gathering information, but remember, what sort of information are we trying uh, to gather? And what I did was the patient has these, okay? The patient has these are called the patient's
Concept.
okay, patient's concerns or the patient's agenda. Okay, the patient's agenda is usually an idea, a concern, or an expectation they have. Okay, so here anxious means concerned. Okay, there is a concern with the breathing, with swallowing, and voice. And I need to explore these. And I just explored the most important one, which is the breathing. I didn't explore much about swallowing because I know that this is thyroid and this happens. And the voice the same. I didn't explore much. If I had time, I might do. But this is the most important one. And I did something here, and that was what we call a safety netting. Okay. And what safety netting is actually to tell the patient what to do in case. Okay, so inform the patient what uh, mm, causes an emergency and what to do. Okay, so I said if suddenly you get short of breath, if it happens suddenly, then this is an emergency and you need to go to A&E. Okay, so that is a safety netting, and um, that is a plus if you use that, if you say that, right? Now, so what we need to know, basically, as uh, a doctor needs to find out patient's real agenda and respond to that. And this is what you're supposed to do. Yeah. So if you do that, you're a good doctor and the patient is very happy with you. Okay. So how to find patient's agenda? This is it. Sometimes the agenda is not very clear. Sometimes it is hidden, but sometimes it is clear and it is given to us. Okay. And how you respond to that agenda, like this. Okay. So basically, we try to, while we're gathering information, what we try to do is to understand what the patient's idea is. Is everybody there? Are you okay?
Yes,
Yeah.
completely correct.
Okay. And what is the patient worried about, or what the patient is expecting to get today? And then when we understand that, we later in the conversation, in information giving, we mention that. We said, you mentioned earlier, and this is called signposting, guys. So this is signposting. You mentioned earlier that you were concerned you might have angina. I can see why you might have thought, but okay. So we explain. We relate our information to all the agenda. Remember, we need to respond to the agenda, real agenda. Okay. That's what we do in the information giving. So if I don't give you enough information, then you won't be happy, right?
Yes.
And right. So yeah, basically, in order to do that, we need to elicit and explore patients' ideas, concerns, expectations. We need to find out what the patient thinks about the illness, or why the patient is concerned about the illness. And asking directly or encouraging elaboration. It means elaboration. What is that? Explanation, more detail. So we need to ask directly, or we need to encourage the patient to explain more. Like I say, well, you said shortness of breath. What exactly do you mean by that? I mean, when did it exactly happen? I have to explore it. Does it happen all the time? Did it happen after operation? When did you have, when you did, when you first noticed it? And so that is something, that is what we call exploring. We have to explore all those all the agenda. So that was a breathing, which was the important one. Uh, and then picking up cues. Right. What is that? Tell me again. I think we discussed that, but tell me again. What is cue?
You, you want to
And
understand patient understanding.
based on patient symptoms. When the patient tell that I cannot swallow or I cannot breathe, we can say him that because of operation you cannot swallow.
Okay. Right. Okay. I tell you something. Um, I have a patient who comes to me and said, "Well, doctor, I've had a chest pain for 2 days, and well, it's not very important, but because one of my friends had chest pain 2 months ago and he died because of a heart attack, I just thought I would come around and have a look and have a check." And so, what is the cue here?
Hesitation that
Mhm.
first she said that I don't have any problem, then hesitate and change the position and said one of my friends have this problem.
Right. Okay. So basically, yeah. I mean, she's telling me that it's not important. I know it's nothing, but a friend died a few months ago. So that is a cue. So that is telling you that's the main reason the patient is here. Okay. Or for example, I say, well. Um, just in the last couple of months, I had some indigestion, and then last week I had some constipation. So I'm just here to check my bowels and see why I'm getting this indigestion and weight loss. And yeah, it's just that. So the patient is pausing and is hesitating. The patient wants to say something, okay? Because the patient is hesitating, you can understand that, okay, there was something the patient wanted to say but didn't say it, right? Says, okay, I had weight loss for a couple of months, and then I had constipation since last week, and I just thought I would just come and see what's wrong with my stomach, so or my bowels. So basically, the patient is thinking that this might be cancer because the patient has had indigestion, constipation, weight loss, and as the patient has read it somewhere that it might be bowel cancer or colon cancer. So that pause tells you the patient is hiding something or is withholding something. So you ask them, okay, so what do you think it is? So is there anything in particular you're worried about, or what is your opinion? And do you think it might be something significant or something serious? So you need to explore that. You question more. Even if the patient doesn't, that pause is a non-verbal cue. Okay. So we have verbal cues, we have non-verbal cues. A pause, a hesitation, a change in the volume of the voice is a non-verbal cue. But words such as my friend died a couple of months ago, that is a verbal cue. That means that I'm thinking about dying. So, well, I give you an example which is so common in Iran because you practice in Iran. A patient comes to you and says, "Well, doctor, yeah, I'm having this sore throat, and it's been too long, and I took some tablets, but it didn't get any better. So I thought I would come and see you." Okay, what does the patient want?
Antibiotic.
Okay, but I've been taking antibiotic pills, and it didn't get any better.
Penicillin.
Okay.
Penicillin. Injection.
Okay, so that's a cue. Okay, so basically, a cue is something that the patient isn't telling you directly, but that's what you need to pick up. And if you pick it up and if you give the patient the injection, the patient is happy because you have addressed the agenda. Okay, but if you don't pick it up or if you don't respond to it, if you don't give him the injection, the patient wouldn't be happy because the agenda, which was an injection, hasn't been responded to. Is that clear?
Yes.
Okay, so you got the meaning of cue. So basically, when you're talking to a patient, look for cues. Now, suppose, so if you don't have, let me ask you a question. If you don't know the agenda, what information would you give? If you do not know the patient's agenda, what information will you give the patient? Okay, that is a question. What do you think?
I think questions that patient ask us, and although the task we should try to cover the task, that they will hide the agenda in themselves.
Okay, okay. So basically the agenda must be in the task. Okay, but if it is not, then you have to look for it. Okay. What if it's not? What happens? What if it's not in the task?